Have you ever had a patient get food stuck after you've done a filling? They come back and they complain, I'm getting pain in my gum. Have you ever had a patient where you do a filling and they have sensitivity to hot and cold or to biting, and then you end up having to do endo or you end up having to redo the filling? Have you ever had the problem of your temporaries falling off when you do an onlay? Or you try to do a crown but the gum is bleeding and you can't get the impression? So in posterior dentistry, we're going to talk about how do we deal with all these issues in back teeth. Pasquale Venuti is going to come from Italy and help me, and we're going to talk about the basic building blocks of restorative dentistry. How do we get perfect contacts? How do we get a nice interproximal shape that's perfect to keep clean and is easy to stop food getting stuck? How do we deal with deep margins that are so far under the gum and it's a giant bleeding mess? Do we do crown lengthening? Do we do gingivectomy? How do we deal with that? How do we get isolation? How do you do an onlay so your temporary doesn't fall off? We'll be covering these topics. Which material should we use? Should we do an onlay? Should we do a crown? Onlays are trendy, but are they actually giving better outcomes? Do crowns cause endo? Common theory. Is that really true? We'll cover that. So we've got all of these common problems. Both Pasquale and I are clinicians who work in our own private practices. These practices have to make a profit. They're not showpiece practices. And so both of us deal with the same problems you have. Dentistry's hard. It really is. And so we're not going to teach you that there's some magical method and it happens without effort. That's not true. But we are going to show you basic step-by-step things. How do you get the patient profoundly numb to do 4 crowns in a row? How do you do the core build-up so it's fast, it's efficient, and you get nice, consistent results? Why do a core build-up at all? Is it worthwhile? Is it worthwhile doing nice polished preps? We'll show you why it is and how much benefit there is having nice preps. What about the vertical preparation? You will have heard of this. Should we do a chamfer? Should we do a vertical preparation? Pasquale is going to go through step by step how to do a vertical preparation. Perfect for teeth that are badly damaged, teeth that it's so difficult to do normal margins on. Pasquale will go through step by step how you choose which of about 5 different matrices is perfect for each particular case, and when you should just give up trying to do a filling. It's impossible. There are certain cases where you cannot close the contact with a filling no matter how hard you try. You need to recognise these before and just tell the patient it can't be done. So all of these common problems we will go through in posterior dentistry. So come along to posterior dentistry, 2-day lecture. We will go through all these common everyday things that you deal with day in, day out, and how to solve them in clear, step-by-step fashion. Look forward to seeing you there.